Good afternoon, everybody. It's good to be here at the Board of Supervisors meeting here at the Warren County Government Center. Today we're here to have an emergency management briefing on things that are taking place in Warren County. One thing I'd like to say is to the citizens of Front Row Warren County, we're here to help people get through this crisis. We're here to be your spokesperson. We're here to help anyone that needs the help that we can provide in Front Royal. We don't want to scare anybody. We don't want to have anybody get to the point where they're thinking that we're going to be inundated with all the coronavirus here within the next couple of days. We may not, but I really don't think we will. But I want to make sure that the citizens realize that we have a job to do as the mayor and the Board of Supervisors chairman and the rest of the gentlemen here in this office today. And we want to let the people know exactly what's going on in our community. And with that, I want to say to the citizenry, don't get that excited. Make sure you follow the rules that are set forward by the governor. Make sure you're following the rules set forward by the county as well as the town of Front Royal. But again, we want to give you the information that we have, and we'd like for you to listen to it and take heed to the things that are being said today. The only way we can stop the spread of this virus is to stay away from one another, stay away from the places where you come in contact with people, and hopefully that by doing these things that we have been asked to do, that we can cut down on the cases here in Front Royal, Warren County in this area. So please do that for the mayor and for the Board of Supervisors as the rest of the county. If we can do that, I think that we'll survive this crisis at this time. At this time, I'll turn it over to the chairman of the Board of Supervisors.
Thank you, Mr. Mayor. First off, I'd like to thank everybody for joining. And I can only tell you that our county can only be as prepared as his citizenry is prepared. We are going through a crisis that probably nobody in this county has went through before. There's changes happening every day. The situation is evolving every day. And to be able to make it better, we have to listen to the folks that are trying to give you the information that's going to help make it better for you. Trust it and then verify it. Please check any presumed facts that you may read on any of the websites that you go to. Check the information that's coming across from your friends. It may be true, it may not be, but if you've got places that you can make phone calls to help you get the right answer. And to get the right answer means that you have to do a little bit of work. Just don't assume that every fact that you believe is being put out is a real fact. And I just want you to know right now that there's no currently approved vaccine. There's no magic pill to make this thing go away. It's all going to be up to the citizenry. The government or the town of Front Royal and the county of Warren cannot protect all of its citizens. We can be prepared, but we cannot protect you. That's up to you. And there are simple rules, at least to start with. And to be able to start, you've got to pay attention. I get so frustrated when I see gatherings of people that are just sitting around hugging each other and shaking hands and being friends. Let's step back just a minute and take a look at what's going on. What's going on is every time that you touch somebody, you've touched I don't know how many other people. And that virus can be transmitted by touch. I'm not saying that it's going to get to everybody. It's not. It may be as simple as a mild case of a flu-like symptom. It could be moderate. It could be extremely dangerous where we're putting people in the hospital. Those are the ones that we're trying to protect from. When you're self-imposed as quarantined by your doctor, take it to heart. Seriously, take it to heart. Because when the doctor has told you to go get tested, there's a threefold process that you have to go through to get tested. And they're going to ask you questions about your temperature, whether you've got aches and pains, whether you've got shortness of breath, whether you're having real difficulty. Don't go just because you want to know. There's not enough tests to go around. They want to test the people that are sick, not just because you want to know that you're okay. We don't have enough test equipment to do that, or test kits to do that. It's in short supply. Everybody knows they're in short supply there. It's being taken care of by people that are way above us. They're getting them out as fast as they can, and they're doing a better job. Every day we're getting more. But please just be aware. Remember the things that you need to do. Wash your hands a lot more than you should. Your hands are going to get cleaner. Your hands are going to look sometimes a little prunish. That's okay. We're doing our job then. If you got a cough into your elbow, or a handkerchief, or a tissue, something that you can throw away, or something to keep those cough germs from spreading. Pay attention to the surfaces that you touch. Wipe them down as often as you feel that you should. Even more. In our county offices, we've got somebody that's doing nothing but walking around all day long, wiping down stuff that people may touch. And our public office isn't even open to the public, but it's open to the citizens that are working with the government. It's really, really, really important for you to take care of the individual. The individual is your family. If you get self-quarantined by your doctor because you've been tested, it's not just you, it's everybody in your family. It's every person that is in your family. Remember that. Don't let them go out. You're going to be stuck in your house for 14 days. I hope that you've got enough food, and I hope that you've got enough water to be able to take care of yourself. If you don't, we're going to try to help, meaning the government, county, town, churches, civic organizations. We're trying to put together things that if you have a problem, you call somebody, you call the county, you call the town, and you say, I need some help. And we're going to go help you. Our police department is going to come visit. Don't be surprised if at some point they don't come. They come to you and they have a mask on or a pair of gloves. It's not to protect them, it's to protect you. Because remember, they're out there seeing people all day long. Everybody that you see is seeing other people and possibly touching other people. Just bear it in mind. I'm not running around with my hair on fire. I'm just actually being concerned about every one of the individuals within our county. I don't want anybody sick. I mean, there's already one case that's been confirmed in Warren County. That number's going to go up. Expect it to go up. You can't not have an epidemic and not have people get sick. We don't know where they are. We don't know where they live. We don't want to know that, folks. We just don't want to know. What we do want to know is the county and the town are doing everything that they can to make sure that you're being taken care of. Business as usual. The public buildings are closed, but you can still transact just about anything. I mean, our planning department is open, our finance department's open, the cable company is going to be open. You're not going to have a problem getting your trash picked up or going to the transfer station to dump off trash. It's going to be working for you. Let it work. We have to just be aware. And to be aware means that you've got to pay attention to what you're doing. Pay attention to what your kids are doing. Pay attention to what your neighbors across the street are going, which brings up another point. You've got to go look out for the older folks, the veterans that are living alone, the people that don't normally get in and out. They are people that you see coming and going. And make sure that if you're going out, maybe give them a call. hey, do you need some bread? Do you need some milk? We can't all go at the same time because then you're going to have a run on the stores. We don't need to do that either. We just need to be smart about it. Think about having enough food for 2 weeks, just in case. And if you don't, and you get sick, tell somebody. They will help you. Let's see. Don't overload the medical system. I can say that because we've got physicians out there, we've got paramedics out there, we've got EMTs out there, we've got doctors, we've got nurses, we've got all of these people that are here to help us. And they want to help. But if we as individuals go out there and overwhelm them, they get bogged down. Let them help you. You stay at home, and if you think you've got it, talk to your primary care physician. They'll tell you to come in. They'll ask you questions. They'll tell you whether to get tested or not. And then if you are tested, take their advice. It may be as simple as a very mild case, just like the flu. You go home, you live through it for 2 weeks, you hate it, but then you get better. It may be moderate, where you're feeling just really, really ill. Same thing, you may be put under house quarantine, so to speak. That's okay too. You've got people out here that are willing to help, and the county and the town are willing to help. We're joined at the hip here. We've got, if you notice on our table, we've got the fire department, we've got the emergency management group, we've got the town administrator, we've got the county administrator, we've got the mayor, we've got the board of supervisors, we've got the Commonwealth's attorney, we've got the sheriff, we've got the chief of police. They're all here. We're all part of this together. And over the next few weeks, every Thursday, we're going to have a status meeting, just so you know what's going on. And we have to be aware. That's all I can tell you, and I'll just tell it over and over again. We have to be aware. Remember, there's still going to be trash pickup. There's still going to be phones. There's still going to be all of the necessities, because your government is following up on that, and they're making sure that there are essential people out there that are doing their job. In the future, be prepared. We may get direction from the governor to go into a lockdown, so to speak, or the next level of confinement. That doesn't mean that you're stuck in your house for 21 days or 14 days. It means go into your house, be prepared for it, watch TV, do house projects, do whatever you can do. But if you need groceries, you can go get them. If you need to go to the doctor, go to the doctor. If you need pharmaceuticals, go to the drugstore. They're going to be open. But be aware of what you're doing and who you're seeing. Let's get past this. I don't want to say the media has hyped it out of proportion, but this is not something that we can't control ourselves. I mean, we lose 50,000 people from the flu. We're not anywhere near that, folks, in the whole United States. So right now, the hospitals have plenty of beds. They have plenty of ventilators. And if they don't, we've got places already set up, and we've planned for them. We've planned for, in case we need to have an open area where we put beds, we've got it available. Let's just think a little bit. I'm not trying to scare anybody. Actually, I'm trying to do what I can to calm everybody down, because I've been reading on my Facebook. And of course, if it's on Facebook, it must be real. That's not true, folks. It's not true. Ask somebody, verify what you're hearing. And I believe that you're better off that way. And now, the governor continues to encourage its citizens to limit people interaction with 10 or less. Remember to Support your social distancing by about 6 feet between people. If you look around the table here, we're doing as best we can. And if we've got more than 10 people in our little area here, we send them out. Because we want to be able to protect ourselves the best that we can. Wash and sanitize your hands as often as you can. Clean commonly touched surfaces to make sure that they're clean. If you're sick, stay home. There isn't a company that I'm aware of that's going to beat you up for not coming in because you're feeling bad and you think there's something going on and you want to let it rest so you can decide whether you need to go see a doctor or not. If you're sick, stay home. Avoid sick people. If you know they're sick, stay away from them as much as you want to help them. If they asked you to go get groceries for them, go get groceries for them, but come back. Take it to their front door, ring the doorbell, knock on the door, back away. Let them come to the door and pick up their food. They'll wave at you, they'll thank you. If you need to cough, cough in your elbow or a handkerchief or a tissue. If you think you have the symptoms of the COVID-19, contact your primary care physician. If you have a general question about COVID, contact the Valley District Health. Like I said before, our medical system does not have the capacity to check people just because they want to know if they have or they don't have COVID-19. To start the process, our citizens will need to start and contact a primary care physician first so they can get a request to go get tested. I'm going to ask you to look at the restaurants that are doing carryout. Those people are there for a reason. Remember our restaurants, because most of them, they're dining restaurants where people go in and they sit down and they have a good time. They've shut their doors to walk-ins, but they're open for carryout. Support them. Support local where you can. Churches. We've got a group of churches that are trying to get together to help the senior citizens. We've got Rotary. We've got plenty of civic organizations that are trying to help do whatever they can to make sure that whoever needs something gets it. I can only ask that you help. You help the people and the citizens around you by helping yourself. Stay away from the problems that you think, because you have to think about what you're doing. And I've seen a lot to where people just aren't doing that. And like I said before, I'm very concerned about every one of us. With that, I'm going to turn it over to John Bell. John Bell is our Commonwealth attorney. A couple of people are going to walk out. The sheriff is going to come up. The chief of police is going to come up. And I'll turn it over to him so he can talk about the executive order number 53. That's the one that came out here a few days ago. And it's one that we have to pay attention to, live with, and hopefully do a good job of getting better. Sheriff, you want to come up and sit down? Thank you. Thank you, Mr. Bell.
I've been asked to talk today about the latest executive order from the governor that deals with the regulations we're working under for this health crisis. Now, the governor's orders are based on the Code of Virginia, section, Title 44 of the Code of Virginia grants the governor certain powers in an emergency. And the declaration of emergency was made on what was Executive Order 51. Yeah. And once that was declared, that gave the governor certain powers that he's then followed up with subsequent executive orders. We are dealing right now with Executive Order 53. That's the one that's made the papers. That's the one that places some actual restrictions. You know, previously, a lot of what was out there was recommendations, you know, which were not binding law, but suggestions that people followed. Now we're subject to decisions by the governor that are actual binding laws. Now, the first part of that is the private gatherings and public gatherings of less than 10 people. Now, prior to the Executive Order 53, there was a suggestion that you reduce groups to sizes 10 or less. Now, all public and private gatherings in person of 10 or more individuals are prohibited. That has the force of law and can be enforced by the Sheriff's Department or the Police Department. There's been a lot of questions about movement. You know, can I leave my house? You know, am I free to travel? Can I go on the interstate? Do I need permission? At this point, there are no restrictions on public movement. There's no need to produce any kind of letter to go from here to there. There are no restrictions for you to go visit your family. There are no restrictions for you to go buy groceries. There are no restrictions for you to go to the gas station. That is not in place. You're not committing a crime by getting out of the house and taking a walk. So don't worry about that. Now, there are some restrictions on businesses. Basically, we've got 4 categories of businesses now. One are your restaurants. Restaurants are not closed, but in-house dining in your restaurants is over. You cannot sit down in a restaurant and have your meal. However, restaurants are allowed to do carry-out and they are allowed to do delivery. So the next category is what are called essential businesses. And the essential businesses are those, there are grocery stores, pharmacies, other retailers that sell food or beverages, medical laboratory vision suppliers, electronic retailers, automotive parts and accessories, home improvement, hardware, building supply retailers, lawn and garden supply retailers, beer, wine, and liquor stores. Retail functions, gas and convenience stores, retail within healthcare facilities, banks, other financial institutions, pet and feed stores, printing and office supply stores, laundromat and dry cleaners. Those are all essential businesses. Those are open without any restrictions other than the requirement for all of us that we try and keep that 6-foot social distance. There's no limitations on hours, no limitations on the number of folks who can come in or out. If you need to go to the hardware store to do something at your house, you're free to come in. You don't have to make sure there's no more than 9 other people in there. You're good. Those businesses stay open. Now, there's the other category is businesses that are just flat out closed. Those are characterized as recreational and entertainment businesses. And effective on this last Tuesday at midnight, those were directed to be closed. The theaters, performing arts centers, concert venues, museums, fitness centers, gymnasiums, beauty salons, barber shops, or any personal care or grooming services are performed that would not allow compliance with social distancing guidelines that you remain 6 feet apart. Racetracks, bowling alleys, skating rings, escape rooms, indoor shooting ranges, private and public social clubs, all other places of indoor amusement. Those are shut down. Now, I have seen some advice from the governor's website that says basically, some personal care services can still meet individual clients in those clients' homes or other locations and do their services as long as they are taking appropriate care and sanitation. But as far as a business, no, those businesses are closed. Now, the last category is all other brick and mortar retail businesses. If you're not listed as essential in 5, you are allowed to stay open. However, you are subject to a 10 patron limit. Now, that's patrons. That doesn't include your staff. That doesn't include the owners. It's 10 patrons. And if you cannot adhere to the 10 patron limit, then it's required to close. Now, one catch on this is that within that 10 patron limit, you have to maintain social distance, and that's that 6 foot. So if you've got a very small storefront and can only fit 10 people, and those 10 people are shoulder to shoulder, you've got an issue. So the governor's order does not shut down most businesses. Most businesses are still there. And I've had the question come in earlier, well, I've got a tree service. Can I still do that? If there's no restriction on that business. Now, any outdoor businesses are good. If you are mowing somebody's lawn, if you are repairing somebody's roof, there are no restrictions on that. Now, social gatherings and church services. That 10-person limit applies to church services. If you're going to mosque, synagogue, or your church, that 10-person inside is a limit. If you go to the State of Virginia website, you can get a link to a COVID-19 advice site, and they'll note that under that site there's encouragement to find creative ways of participating in worship services. Suggestions are virtual services, services that are live streamed, services that are held in such a way as people are not within that 6 foot limit or not violating the 10 person. There's even some encouragement of experimentation with drive-through services. So the governor has called for people to be creative, but also to be safe. Now, right now, we hear about quarantine. Well, from my perspective as an attorney, quarantine is a legal terminology. We are not having people closed. We haven't had people quarantined in the legal, enforceable sense much these days. But we have had people who they've been recommended social isolation. If you are in the vulnerable categories for this, it's recommended that you isolate yourself. You are not under a legal quarantine, but you've been requested to stay home. It's common sense. Now, enforcement of these orders. The Town of Front Royal Police Department, along with the Sheriff's Department, have put out a press release which has stated that we are going to enforce this first with education. We're going to try and talk to people, get the message across that this is what you need to do to comply. If people don't seem to be getting the message, they'll be given a formal warning. If the warning is disregarded, then the police and the Sheriff's Department are entitled to enforce through either writing a summons, a ticket, or actual arrest in an extreme case. Now, violation of this executive order is a Class 1 misdemeanor. And for those who don't know, a Class 1 misdemeanor is a crime in Virginia that's punishable by a fine of up to $2,500 or a jail sentence of up to 12 months, either or both. And it is something that would give you an honest-to-God criminal record. So it's nothing to take lightly. Now, our goal here is not to lock people up for gathering in a group of 11. our goal is to try and get people to be as safe as possible. And we intend to gauge enforcement towards people's safety. We're not looking to put handcuffs on folks. What we are looking to do is get people to help their neighbors, to not endanger their neighbors, to not endanger the elderly through their behavior. Now, I've had some questions about folks who have been acting out in other locations, claiming that they're under quarantine for coronavirus and trying to create panic, who say that they're infected and licking things. Both the Front Royal Police Department and the Warren County Sheriff's Department are prepared to respond to that. At the very least, that's going to come under the heading of disorderly conduct, which itself is a misdemeanor. And we are prepared to put a stop to that immediately. We are not interested in people out there causing panic. We are not interested in people out there causing fear. And we are not interested in people doing things that might endanger other folks. So we will respond to that. Now, keep in mind that we are in a fluid situation. We started with Executive Order 51, which declared the emergency. We had an addendum to that which invoked certain health regulations. We had an Executive Order 52 which freed up regulations involving hospital bed space, and we are now on Executive Order 53. The governor's authority is such that we could go further than that. So I want people to realize that this could change. There could be more restrictions coming down the pipe. The main thing to remember is the whole purpose of this is not to punish the public, to confine the public, but to protect the most vulnerable among us. And we're not interested in making this a power play by the police department or the sheriff's department or the Commonwealth Attorney's office. What we want to do is get the word out to try and get people to help each other and to be safe.
All done?
Well, I think I've said more than enough.
Well, there's one group that I wanted to talk about very briefly, and that's the school system. The school system has done some pretty amazing things over the last 2 weeks. They've come together to help feed our young people. When we first started talking about a week and a half or so ago, we fed 61 kids because the school system had opened their kitchens to any family that brought a young person to one of the schools. They gave them food. It was 61. Then it went from 61 to about 125. And then it went from 125 to about 250. And the last one was a little over 300. That's 300 kids that got 2 meals a day. Now, starting tomorrow, I believe that they're going to try to put 1,000 meals out. And they're going to use the school buses to do that. And they have 20 locations that they picked out that they're going to take food to those 20 locations just to make sure that young people meaning K through 12, to get food that they need and they want because their parents have to be at work or something. If they want it, they're going to get it. Doesn't matter whether they're on the assisted scale for meals, doesn't matter. If there's a young person in the car, they're going to get fed. The other thing, they're going to increase that to 2,500 or more over the next coming week or so. They're going to do everything they can, going out and giving young people food. I appreciate that. You're going to, as you get involved in staying home, there's a thing called cabin fever, and everybody knows it because I get it when I'm home more than a day. I'm ready to get out and go somewhere and do something. But we was to have to stay in for a while, cabin fever is going to set in. Just remember, you're not forced to stay home unless you're sick. And then you can go out. Go to the parks. I have to tell you, there's going to be a sign posted that says, play at your own risk. But you can go to the parks. We're going to go out, the county's going to go out to all of the parks and wipe it down as much as they can, at least weekly. To me, that's a big deal because people are going out there and doing these things for the kids. I would take your own wipes so you can wipe the seats so the kids can swing on the swings, play on the seesaw, do whatever the kids do, run around. Just maintain social distancing and get some of that pent-up energy out. I'm one of those that just believe that if we pay attention to what's going on around us, we can do better. And with that, I'm happy to open it up to any of our team that's here, to any question that we might need asking, that we hopefully can answer. Like I said, these are evolving days. We may not have every answer, but we've got a lot of people that are concerned about things, and if we can answer them, we will.
Mr. Chairman, if I could just make a couple points.
Okay.
Doug Stanley, County Administrator. First of all, we have a local emergency management planning committee that we meet on a regular basis. We drill each year. We do shelter drills to make sure that we as a community are prepared for events like this. Yes, the coronavirus pandemic is unusual. It's unusual in the duration that we're potentially facing. But I want the public to know that your community leadership is prepared to meet this head on. We will be ready for what we can do to address the impact on our community. And the second point I want to make is there are lots of great organizations in our community, some nonprofit, some governmental, as the chairman mentioned, that can help meet the needs of our community, whether it's the kids in the school system or the older folks dealing with SAAA and the Meals on Wheels program, or the churches in our community. As government leaders, we're here to help prop them up and support them where needed. But please reach out if you need help. We're here to answer that call.
Yeah, thank you, Doug. That's a really critical point. And Mr. Chairman and Mr. Mayor, thank you for those comments. I think that's real critical, Doug. You know, this team is not winging this crisis. The county has a disaster plan, emergency management plan, and it's being executed. We're communicating frequently. We're communicating well. We're working together well as a town and county government. The police chief and the sheriff are working together daily, multiple times a day, communicating and planning and executing the plan. We're going to get through this pandemic together. That's how this is going to work. From the town's perspective, all of our mission critical operations are up and functioning and effective at 100%. Our water plant, our sewer plant, our electric plant, our refuse collection, town administration. We have months of inventory in anticipation for this pandemic. We have months of inventory stocked up to run these critical services. We have 2 shifts that's been segregated and separated in case one shift gets quarantined. We're able to run those functions. We have backup people identified. We've talked to other jurisdictions that have these critical services that they'll be able to pull in some folks should we need them. We're ready to operate and we're ready to help the community with the county. The county's taking the lead on this, right? Town of Front Royal is within the county. This is the county's emergency management plan that we're working together. From the town's perspective, we've created a COVID-19 webpage, as the county has, and we're sharing information on our pages. From the town's perspective, our webpage is www.frontroyalva.com/local response. We also have just launched a COVID-19 hotline. 540-622-0555. And the point of that is just to have a place, should people need something that they can't get hold of the county resources, they can call that number as well. Our goal is to provide the locality with as much accurate and timely information as possible. And frankly, gentlemen, I couldn't be more pleased with how this is going. And Rick, you deserve a pat on the back for your efforts. So that's from the town's perspective, Doug. I just want to thank you guys for what you're doing.
Sheriff Butler, Warren County. In the past 3 months, it's been a heck of a transition for us anyway. In the past few years, our county's gone through many different obstacles, met resistance and issues throughout. One thing about this that I've seen, excuse me, is that we have actually joined together and come together in a crisis. We have a major in our department that is extremely experienced with emergency management and certified. Working with Rick Farrell from the fire department and us working with the town and the police department, it actually is something that I know I haven't seen in many years as a resident of Warren County. And I could not be happier than to be the sheriff actually being able to witness this actually all come together and us actually maybe heal as we get better and work through this. I welcome it all. I'm thankful for it. Thank you.
Kim McGillis, Federal Police Chief. I echo the sentiment of our sheriff. It's been great being able to work together through this troubled time, and not just working with our partners in government, but with the citizens of the community. I think that's going to be the key to getting through this. We're all in this together, and everybody doing their part and trying to stay healthy and following the guidelines and the protocols is what's actually going to help us get through this. So thanks in advance to our citizens and our community in partnering with us to get through this troubling time. Thank you.
And if I could follow up on one thing, our office is always available to consult. The number for the Commonwealth Attorney's Office is 540-635-5441. But a lot of questions are already answered through resources available from the Virginia State government webpage. If you go to virginia.gov, one of the first things you will see is a link to a site for coronavirus updates. And if you go to that page, they have a menu of almost every sort of question that may come up, and also a link to a frequently asked questions page. That document is about 9 pages long at the moment and goes into a lot of detail. So if you have a question, go there first, take a look at it, see if your question is answered. If you doesn't answer your question about whether my business is legal still or not, you can call the Commonwealth Attorney's Office. I will give you my opinion for what it's worth, or I will try and find somebody with a more authoritative opinion, and we'll follow up from there.
As we began, I'm Gene Tewald as the mayor of Front Royal. We have a lot of experience here in this room this evening, and I'm really proud to say that I can be part of this grouping that are here. I know that I've talked to Rick, I know I've talked to the sheriff, the police department, Mr. Babe, the chair of the board of supervisors, Mr. Tevick, our town manager, and others that are here in this building. Again, as mayor, I want to encourage the public in Front Royal, especially our citizens, to listen to what has been said here this evening. It's very important that you pay attention to these things. And if you pay attention to those things, this pandemic may not be near as bad as we may think it's going to get. So I'd like to encourage all the constituents of Front Royal to listen, pay attention, listen to what Chairman of the Board of Supervisors has said earlier in regards to their public health and the things they need to do. And with all of us working together as the county, the sheriff, the police, and everyone else, we can get through this pandemic pretty quickly. Hopefully that we can get this probably in the next month or two. So with that, I'll turn it back over to the chairman of the Board of Supervisors.
Thank you, Mr. Mayor. Is there any questions from out in the limited audience that we have? Yes, sir.
Roger.
Do you have any stats, or you said there's been one confirmed case in the county. Are there any stats on how many people have been tested in Warren County, which has a population of around 39,000, 40,000?
Roger, it's Rick Farrell. We don't have those statistics. EDH stopped putting that number out, so it's just a roll up at the state level now.
And related to a conversation we had earlier, is there any way to comment on what you know or don't know about the confirmed case? You know, was it a person who was in the vulnerable group, age-wise or health-wise, or do you have any information? And as you explained to me, could you explain how you have what you have?
Sure. Right now, for protective reasons for our population, and if you do become a patient, we know one thing, that we have a case in Warren County. I can't tell you if that person is admitted to a hospital somewhere. I can't tell you if that person was sent home to self-isolation or self-quarantine. And I can't tell you that that person has left the area. Only that we have one case that is attributed to Warren County.
But some information that you have is because you have information that this person wasn't transported by emergency services in the county, right?
That's correct. So from a first responder perspective on the EMS side, we will get feedback if we had contact. So for instance, if I transported a patient in that was a positive COVID-19 case, I would get a call back through infection control channels to make sure that I'm okay as a provider, and that is also the law.
So you know you didn't transport this person?
In this case, we're getting word that there was no EMS contact for this first confirmed case.
Yeah, Max Garber from Northern Virginia Daily. You guys have been planning for some time. Now that there is a confirmed case, does this change any calculus, any plans that you guys are rolling out, your approach to anything now?
Right now, we're trying to be as measured as we can. And as John said earlier, anticipating that the governor may ratchet things up just a bit in the near future, we don't want to try to get too far ahead of them. So both the town and the county governments are still open. We only have one case that is reported right now, so there's really no need at this time, I think, to do anything drastic unless our numbers really skyrocket.
Can you talk about what that might look like if we do see a ratcheting up of the number of cases in the county?
Well, I guess it was in, as Mr. Bell discussed, if the governor does go to a shelter-in-place order, that will be a bit more restrictive for our citizens and for all of our employees, and that's where you'll hear the terms essential employees and non-essential employees. So at that point, we would have our non-essential employees stay at home, telework if possible, or do some kind of work at home if they can, and if they can't, then they'll be at the home, and the essential employees will be at work.
Anybody else?
Also add, I think that's where you might see us also closing some of the park facilities and other facilities in and around the community if we reach that next level. As Rick stated, everything we've done has kind of been in measured increments and taken the direction from the governor. And the town and county have been in lockstep. We've coordinated both the closing of the offices to the public because there is things like building inspections and planning and zoning. So I personally, having been in this community and working for 25 years, I've never seen as much cooperation as we have right now and working together on this issue. And I think that, we realize the seriousness of the event, and I think that's brought us together, and we'll get through this together.
Are town and county public meetings going to continue? What is that going to look like?
For right now, the meetings that we have with the Board of Supervisors, and I can only speak for the Board of Supervisors. We're going to be doing electronic meetings and some live streaming for that, so we can have some citizen input on those, just like we would normally. So we're, as of right now, we're business as usual. Am I incorrect, Mr. Stanley?
No, sir. Again, we've been trying to, the live streaming, and we have an email account set up to be able to take input for the budget. And we've got a public hearing coming up on the 14th. The reality is, local government, we still have things that have to continue on. And the budget and the setting of the tax rates are obviously two great examples of that. We had a jail meeting here earlier, and you were here, Max. Things have to continue on, I'll bet a little differently in form and function. And thankfully, we've gotten some direction from the Attorney General's office that gives us some flexibility to be able to hold the meeting electronically, whereas before we didn't really have that. So we're going to do what we have to do to make sure that government functions, essential functions, continue on. We'll have staff to be able to carry out the day-to-day things that need to happen, things like picking up or disposing of trash, emergency medical services, the paying of bills, certain things that have to happen every day. So we'll make sure that our staff is safe and that we can do those functions to make sure and ensure that government continues on.
As far as the town, we're going to continue with our regular meetings. We will do it electronically. Our next meeting will be next Monday evening, 7 o'clock, but like I said, it'll be done electronically. And we'll be continuing to work on our budget and the other things that we need to do between now and this epidemic is over, and hopefully that it's over quickly. So we'll continue this, as County Administrator said, we'll continue our operation as if nothing's going on. It'll just be limited as far as the buildings not are open. But other than that, all functions of Front Royal will continue to operate.
I can tell you the sheriff's office, it's everyday business as usual. Maybe with some other influences or directed. We actually have more officers now since school's out that we can direct somewhere else, our SROs and some of our court officers. So we actually have a desk sergeant working during the prime hours to take calls directly, so we can handle just about anything as rapidly as possible, working with fire and rescue and also working with the town police. We've been in constant contacts with them, and I think we'll continue that, and I look forward to it. I think it'll just help us as we move on through this crisis, and I think we'll actually get through it a lot smoother because of the cooperation with everybody in this room.
You will see a slightly different response from a law enforcement standpoint. Again, we've got a desk sergeant as well, and they'll be answering a lot of those phone calls and things like that, civil complaints. And there will be a modified response when utilizing the social distancing. If there is a call where we actually have to send an officer to a residence, they may ask you to come outside and speak to them from the porch, just so that we can try to maintain that social distancing to keep our citizens and our officers safe and healthy and able to be on the streets to answer those calls. So you'll see a little bit of a modified response. Bear with us while we try to get through this. It's all being done for a reason. So and that reason is to keep everybody healthy and safe. So thank you.
Additional questions?
I guess I would have just one more comment for everybody. I would like to thank the public. So far, for the most part, everybody seems to be doing the right thing. Our 911 calls on the fire and rescue side are down. So I think people are calling in only when absolutely necessary. And if you compare that to number of ER visits at Warren Memorial, visits are down there as well. And they report that only really the serious folks are going to the ER. So I think people are paying attention right now, and for that, I know as a public safety person, I'm very appreciative of that.
No other questions? Then just want you to remember that individually we're strong. We can prove that every day by what we do. Together we're stronger, and we know this from the way that we plan for tomorrow. So we're learning new stuff. We're planning on how things are gonna come together with everything that's happening. So the next time around, if there ever is a next time around, we'll do it even better. But right now, I believe that we're doing great. And we're here to help. So thank you very much.